you the best view in 2022. We all want to be healthy. It's not always easy, but always worth working towards a healthier you, Elizabeth.
You know, according to the CDC, around 87% of women between the ages of 18 to 44 seek out preventative health care. It's kind of just like part of the routine. But that number really drops as we get older. And here to tell us why that care is so important for women at every age, we want to welcome Dr. Annalisa Swigert from Southdale OBGYN.
Hello.
Dr. Swigert, nice to have you here.
Happy New Year.
Happy New Year. Okay, so we want to be focusing on our health, I think, all the time, but particularly in the new year, we're thinking about it. So kind of sell us on why preventative care is something that you need to think about throughout your life.
Well, now's the time of year when everyone wants to be their best self. So we're all thinking about getting more healthy. We're thinking about exercising more, eating better. And now really is the time to think about getting in to see your OBGYN or primary care provider for preventative health.
Yeah.
We know that the best way to stay healthy is to prevent things with cancer screenings, getting immunizations, talking about what's normal, what's not normal. And I can go through kind of the different age groups, but at Southdale OBGYN, we see women of all ages, and we tailor that preventative health visit to your age.
Oh, that's great.
What about teenagers?
And teenagers, important time to come in. You know, some girls may think they still need to see their pediatrician, but we help teenage girls start to focus on things like contraception, understanding options, healthy eating behaviors, immunizations, things like that that are important to get them ready to go to college.
So when do you want teenagers to come in for the first time? I remember being a teenager and that being like a big deal. Like, when do you go? How do you have to go? You know, like what's an ideal recommendation for you?
You know, I think once girls start, you know, having their period or having concerns about their period, that's a good time to do an initial visit. When we do our teen preventative exams, we talk first with our teens. We get to know them first. They don't necessarily need, you know, a full exam with us, but we start with education, making sure they understand the questions that they need to ask and what they need to look for.
This will be coming up. We have daughters that are 7.
I know.
We're a little
feels
ways
like a
off
strong
though, right? This
person.
isn't...
I will tell you, I just started watching Bridgerton. Listen, think about that show, what you want. But I have been so shocked by how little these girls back in this time period knew about their bodies and sex. It was like unreal to me. I'm like, oh my gosh.
Yeah.
Anyway, they really needed you in that time period. So I'm glad that you're here now. Okay, let's talk about women from the ages of 20 to 40. What's the kind of preventative health care that we're talking about there?
Well, when women come in at that age, we start talking about family history and any genetic testing that we might want to be doing to help them be their healthiest self looking towards pregnancy. We do a lot of discussion around preconception care, a lot of discussion around fertility. A lot of women are now doing their own research and education on what do I need to know now to prepare to be healthy, to be pregnant, even if it's 1 year down the road or 10 years down the road.
Isn't that so good? I mean, that's so great that they're doing that research and that you're having those conversations about what to do to have a healthy pregnancy, just other than being like, oh, I'm just going to get pregnant and then figure out what my care looks like. It's good to have that ahead of time.
Yeah, we've had four kids, and the experience with our OBGYN has always been so helpful.
Right.
So helpful.
All those things
Always
that
so
you need to
thankful.
know. Okay, what about 40 to 55, when things start to shift a little bit?
Yep, so again, same things around making sure that we're talking about family history, any genetic screening. We start talking about hormone changes, and I know on a previous episode we talked about all the things that happen in our 40s. Really important to start understanding what's normal to experience, what's not normal. We start talking about cancer screenings. Now I will say we do start with cervical cancer screening at 21, so that's important for the younger women. But starting at age 40, annual mammograms are important. Colonoscopy now, age 45. And we also talk to women about, depending on family history, what is other lab work or tests that they might need to make sure that they can prevent other diseases such as heart disease, high cholesterol, diabetes.
Does preventative care sometimes feel like something you mean to do and then you just never end up doing it, but it's just so important, right? So what would you recommend to people who they're like, I should do that this year?
Well, that's why I like looking at the new year as a perfect time to go in and see your provider, because it is the time to think about your best self, and it's the time to re-ask yourself, what do I need to do now? I need to get in and see my doctor. And we have time. It's cold. We don't have a lot of other fun things going on, right? Go in and see your doctor.
So just make a list of your appointments. That's kind of a good, though, resolution, though, I think, to like get a handle on all those things that you really need to be taking care of. Okay, when it comes to those menopausal years, what are particular things that you want to be talking to women about?
Well, even women over the age of 60 still need to see a women's healthcare provider. There are still issues around sexual health, still issues around cancer screening, still issues that come up for women that are really unique to being a woman and the care that we provide. So I encourage women of all ages to see us.
And then also depression and anxiety. Let's talk about that. What is something that you're talking about every time that you have somebody in, I would say regardless of age, right? Are you having that mental health conversation?
Absolutely. We now understand much more than ever before how important our mental health is. And we know that it is important to offer screening for both anxiety and depression at every visit, at every age. It can be difficult for a patient to bring up a conversation around those feelings or even understand whether something's, again, normal, not normal, something that might need evaluation or treatment. So really important part of every preventative visit is talking about mental health.
It's so great, even with the younger ones too.
I know.
Where they might not talk to the parents, but if you ask a question, maybe they're able to open
Maybe
up.
they'll talk to you. And I think, you know, what you've just done too is I think shown us how holistic the practice is, that when you think OBGYN, you just kind of think about particular types of issues. But you just listed off all these different whole body wellness and health important things that you're tackling at these appointments.
We really pull everything together for women. We help them understand what their unique needs are, and we can refer out as needed when we need other specialists, but it's about understanding the whole woman.
Yeah, that's great. Dr. Sprague, it's so nice to have you here.
Great
we
to be
love when
back.
you pop by. We know that women watching are saying, okay, I'm going to make an appointment now because of her. So that's
All
fantastic. Southdale OBGYN has 2 clinic locations. They have one in Edina and another in Burnsville. And their team has specialized in women's care for more than 50 years. For more information and a link to make an appointment with one of their practitioners, they got all their pictures on the website. You can look. Just go to TwinCitiesLive.com.